So relative to the SI joint, there's a big debate right now in the YouTube world about what causes SI joint pain. There are some people who say the SI joint is painful because of hypermobility, and they argue that doing something like an adjustment or a mobilization of the SI joint actually creates more harm than it does good. And that certainly is a thought that I can appreciate. There are surgical procedures out there that are done to fuse the SI joint, i.e. take the ilium and fuse it to the sacrum to prevent the motion or excessive motion. However, because some people don't feel well with SI joint manipulations, does that mean that the hypermobility is the cause of the problem for everyone? I find that a little hard to understand, because when you really search in the literature, there's not actually a lot of data on this. And if you have data or if somebody has data, please send it to me. But I've been scouring the literature, and really what I've found is that there is some motion at the SI joint. Most of the motion is at the top of the SI joint. It's actually much less than we would ever think of it being. But we can have motion. And there's a question that, can some people have a fixated SI joint, and that's really the cause of their problem. Further, there are many other causes classically learned about in pathology for those going through their postgraduate training or graduate training regarding conditions such as ankylosing spondylitis, also other types of sacroiliitis, osteitis condensans ilii is another one. So there are many conditions affecting the pelvis that can affect the SI joints, and that's what we typically learn. But for the garden variety kind of day-to-day SI joint pain, there might be hypermobility, but I raised the question that there might be a fixated SI joint. And then within that, can it also be relating to this degenerative kind of ligamentous damage that's being discussed in some of the literature? So not a typical brain topic, but I figured I'd kind of give you something off the beaten path. This is an area of interest of mine, and send me your questions, your comments. Everyone have a good night. Dr. Randall Gates, board certified chiropractic neurologist and chiropractic physician from Gates Brain Health.